Good morning, everyone, and thank you so much for joining us today for the presentation that my colleague Yordi and I are going to spearhead that will talk about services and resources for older Arlingtonians. My name is Michelle Thomas, and I serve as the program coordinator of VICAP. VICAP is housed under the Area Agency on Aging in Arlington County. I'm grateful to see our team members here. We have some volunteers here. So, you know, VICAP is mostly volunteer driven. Thank you all so much for joining us today. And then my wonderful colleague Yordi, who's going to be helping me spearhead this presentation. So we will walk through this presentation. There will be a survey towards the end, and then we will open it up for Q&A. Great, thank you so much. So Arlington's population has reached 238,643 people in 2020, which was followed by a slight decline due to the impacts from the COVID-19 pandemic, which occurred in major metro areas across the country, as we all know. According to the U.S. Census Bureau, there have been roughly 11% of Arlington's population in 2021 that were estimated to be 65 years of age and older. So that's less than previous years, again, due to the COVID-19 pandemic. So the 2022 population in Arlington County, the 2022 population in Arlington County is estimated at 235,500 people. And I'm still on slide 2. Over the next 2 decades, the proportion of the U.S. population over age 60 is going to dramatically increase as baby boomers reach their milestone. And so by 2030, more than 70 million, or 1 in 5 Americans, are going to be turning age 65 and older. The baby boomers are largely responsible for the increase in the older adult population as they began turning 65 in the year 2011. And so Arlington County, Virginia records the most significant increase occurred for older adults between the ages of 65 to 74, which is what we see in our program, and adults that are ages between 45 and 59. So there's a trend that's projecting up, it's trending up, and there's an increase over the future years. And so as we look at the population, 75% are white, 9.7% are Black or African American, 11% are reported as Asian, and then 15.6% are reported as Hispanic or Latino. Next slide, please. So according to an article written in 2021 by AARP, a national poll conducted of nearly 3,000 people in the U.S. found that 77% of adults age 50 and over want to age in place. And this is also what we hear and see in our program and also in the AAA. This number has been consistent for more than a decade. However, as many people get older and they're aging in place, they will eventually need a level of service or support so that they can live safely in their home or their community. And so some of the supportive services could include personal care services. They could also include help with household chores, help with meals, and then help with money management services and healthcare. Next slide, please. So in Arlington County, many people turn to the Department of Human Services, right, which is where we're housed, also known as the Aging and Disability Services Division. That's under the umbrella of the Department of Human Services, to explore resources and services to be able to stay in their home and live as long as possible. Next slide, please. We're on the next slide, Yordi.
Yeah, are you on slide 7?
Caregiving, yes.
Yep.
So has anyone here at any point in time in the past year provided unpaid help or arranged for help to a relative or friend with an illness or disability that left the person unable to do some things for him or himself or needed assistance due to getting older? If that's you, if you can identify with that, then you may want to consider yourself a caregiver. Caregiving can involve providing assistance with household chores, finances, personal or medical needs, and if anyone within the audience has assisted someone who needed help to live in their home, in your home, or in another setting like a nursing home, then there is a high likelihood that you could be considered in serving as a caregiver role, whether it be formally or informally. Next slide, please. So as we consider the challenges and opportunities under the umbrella of caregiving, there could be challenges, as it deals with the pace of life. That changes for sure. Changes with personal freedom, a need to reassign responsibilities for those who have served in that role. It could mean a decrease in income. I mean, there have been some individuals who needed to pivot from their positions and roles to help take care of their loved one. A need to become more patient because caregiving can test one's patience. It's tough when you're managing many competing demands. But then there are also opportunities when we think about caregiving. So it could also mean that there's more time to spend with your family, a renewed commitment to your family, right? A new perspective. It gives you a new outlook on life. It's also an opportunity, a new opportunity to learn new skills. So for example, if your loved one needs to become reliant upon using wheelchairs, there's a lot of information and knowledge about how to use wheelchairs. And, maybe your loved one has physically declined and can no longer dress or bathe themselves. There's caregiving training out there designed to support you in that journey. There's also an opportunity to reprioritize what's important to your family, right? Thinking about what matters most. And then there's also the opportunity to experience joy that can come through service or by serving. Next slide, please. So as we consider caregiving resources, going back to my previous comment, there are a lot of caregiving training and education out there. Arlington Libraries is a wonderful resource, and they offer things like books by mail. They have talking books. They have one-on-one tech support provided by appointment. They have a massive and sizable collection of large print books and an extensive digital collection as well, for the avid reader who wants to learn more. There's also the 55 plus senior centers where people can engage and move and, become more acclimated with exercises and things of that nature, exercise courses. Sometimes they have movie night, and it just all depends. There are a wealth of resources out there for the older adult resources too that's offered through the Arlington County Library. And then there are some support groups if people are interested in becoming involved in learning more. When it comes to home and community-based services, we have access to and sometimes talk to our colleagues who are elder law attorneys. Depending upon the situation, we've made some referrals to some of the elder law attorneys because as we're talking with individuals, you know, sometimes we open up conversations around living wills and testaments and things of that nature. And so we refer people over to different resources as such all the time. We also have referred people and continue to refer people to geriatric care managers. Sometimes people need some assistance and support in helping to navigate their situation, and that's where a geriatric care manager could come into play as they're trying to make decisions either for themselves or for their loved ones. We do interface with individuals who need some support around, you know, staying in their home from a financial perspective. And then looking at senior, you know, move managers to be able to help. We've gotten calls from individuals across different states, Florida, California, New York. It all depends, and they're looking to be able to move their loved one to Arlington County. That's where senior move manager would come into play. There's also the source book, the Guide to Retirement Living. I know that there used to be a lot of hard copies published, but they have a lot of information that's on their website that's accessible at your fingertips. And then other resources like the Senior Navigator or Elder Care Locator. And then, of course, the Area Agency on Aging, which VICAP is housed under, that offers a lot of information and resources to assist older adults and their families and loved ones. Next slide, please. So when we think about the core AAA services, it's important to note that the AAA receives federal funding and state funding, and the goal is to plan, coordinate, and direct area agencies on aging's activities and programs. We want to ensure that there's compliance with local, state, and federal laws. The AAA also identifies services and initiates programs to provide to community members, either through the AAA or in coordination with other human service agencies or other organizations in the community, nonprofit organizations. I mean, we've talked to and work with friends over at the Salvation Army or Bonder and Amanda Johnson, or, you know, just so many other, Arlington Neighborhood Village. I mean, the list is extensive. And sometimes that's where we receive our referrals from as well. The AAA also helps to ensure that there's a proper and consistent interpretation and implementation of policies and procedures that impact service delivery. And then sometimes, of course, there are surveys disseminated so that we can hear from you about the services that are being offered or what you'd like to see offered and what we can potentially improve upon to make your life in your situation a little bit better. The AAA does also develop and implement program strategies and best practices. And we always look for ways to be able to, again, support community members. And sometimes that's through working with the Commission on Aging. So some of you know, but others may not, that the AAA provides staff support to the Commission on Aging, and the Commission on Aging gives voice, right, to the community to talk about ways to advocate for individuals who are 60 years of age and older. The average AAA offers more than a dozen, additional services, and some of them do include case management. So there's the adult services program among many that's housed, and that also works with the Area Agency on Aging. There's VICAP, which Yordi and I work directly with, that offers Medicare insurance counseling And then there's the Senior Medicare Patrol that we also partner with as well to talk with individuals about fraud and abuse. Next slide, please. So the ADRC is also housed under the Area Agency on Aging, and the ADRC stands for the Aging and Disability Resource Center, and it acts as the first stop to accessing ADSD services and programs. So in addition to information and referrals that are provided, there could be some resources also offered for long-term care services and supports. Housing, nutrition are some of the top requests, especially during the height of the nationwide pandemic. But with income streams changing and, some people losing their jobs, there's so much that's happened on the financial front where there are a lot of people that are still seeking support to this day with getting financial assistance for housing or getting financial assistance for dental work, right? Because as we know, and Yordi and I see this all the time, under the umbrella of Medicare, unless someone has a Medicare Advantage plan, original Medicare doesn't cover dental services. And so you have individuals who may need dentures, for example. That's not anything that's going to be covered on either side of the house, whether you have a Medicare Advantage plan or original Medicare. The ADRC, though, can offer financial assistance to help accomplish that goal. It all depends. There's a screening process involved. For people who may be interested or wanting to learn more, they can call 703-228-1700 or send an email to the RLAAA@arlingtonva.us for more information. Next slide, please. So as it relates to home and community supports, this is another area in which the AAA hears a lot about. And this could entail and include nutrition programs. There's a social 60+ cafe that's offered under the umbrella of Arlington County Parks and Recreation. Many of you have heard about home delivered meals, or what's also called Meals on Wheels. This is something that Yordi and I have been a part of as well. There's nutrition counseling education. The AAA and ADRC also work very closely with AFAC, which is in South Arlington. Sometimes we have referred some clients to AFAC if they're in need of nutritional support. There's also the housing and real estate tax relief. Sometimes we interface with seniors who may have paid off their mortgage, for example, but it's the taxes that are becoming a barrier or a financial burden for them. So looking at resources and referral resources to be able to offer is critical. I mean, other times too, in the AAA, we've interfaced with individuals who, they may be coming home with a wheelchair and they may not have a ramp, and they need a ramp outside of their home, or they need to have a ramp inside of their home to be able to navigate and maneuver, or an elevator or something of that nature. We have referred over to a nonprofit organization called Rebuilding Together in Arlington County. They take referrals from our office and have been great in working with. Rebuilding Together is in a way similar to VICAP, whereby they have a litany of volunteers who help to spearhead their services and programs for the betterment of the community. We get a lot of questions in the AAA about transportation, resources, and services, and always, offer information around STAR or Metro Access. To name a few, there's Red Top Cab, and so many other transportation resources. And then legal services. I know that in the VICAP program, There was a client that I talked to a few years ago, which I'll never forget. This was pre-pandemic, and she, when her husband was living, she was relying on her husband and his income to help her sustain. He unfortunately ended up passing away, and she didn't have any income of her own. The income that they had to go towards some other expenses. She called and she was wondering how she could, get the financial resources and means that she needed to stay in her apartment. She was facing an eviction. She had the notice, and she also received a bill from the hospital in which her husband was before he passed away. And the bill stated that she was needing to pay about $10,000, although he was already deceased. So she was traumatized. Legal Services of Northern Virginia was who I contacted, talked to their staff. One of the attorneys there, we were able to coordinate with one of the attorneys who actually went to court with her. He defended her. We were able to get her the financial resources and means that she needed to, number one, move to an apartment in which she could afford to pay. But then number two, he worked with her on the medical bill. So we do refer to legal services often. Money management and financial counseling too is something we've been able to help individuals get support with and get connected to. It just all depends. Sometimes people are seeking some help or need some help with budgeting or credit repair. And we do have contracts under the umbrella of the AAA with money management companies that we can make referrals to. And then, of course, there's the VICAP Medicare counseling, which Yordi and I are a part of. And I saw Charlie, who is one of our newest volunteers. Charlie, thank you so much for being here today. And so we provide Medicare counseling. Open enrollment is coming up in the fall. Want to give a plug for that, of where we help individuals to assess their Medicare plans and coverage. We help individuals get connected with prescription drug programs, or if they're interested in Medicare Advantage plans. We also help individuals to look at ways to reduce their Medicare. Next slide, please. An additional support or area of consideration is mental health support. So this is still Mental Health Awareness Month. And under the umbrella of the Aging and Disability Services Division, there is what's called the Senior Adult Mental Health Program. And it's a wonderful program that's housed on site. The goal is to keep individuals stabilized within the community. And so on campus at Sequoia, they offer assessments, coordination of care. There's a psychiatrist, there's a nurse practitioner, there's a full integrative team it's like a care team who offers resources and supports to individuals and also their families with being able to access appropriate services based on the needs and preferences that they have. In order to be eligible for senior adult mental health, though, an individual does have to be diagnosed with a serious mental illness. So, we've worked with and I've interfaced or referred people over to that program who have been diagnosed with bipolar or schizophrenia or major depressive disorder, and the list goes on. But it's an outpatient program. It's a wonderful model. And, they have a great team of staff who are so caring and offer the type of resource to keep people stabilized within their home, within the community. There's also the Developmental Disabilities Services Division under the umbrella of Aging and Disability Services Division, and they work with individuals and families as well that have the children. There's a lot of children too that they work with that have been diagnosed with a developmental or intellectual disability. And they help individuals, to get engaged, and for those individuals who are working to have more meaningful work and training experiences based on their level of functioning, skills, and self-sufficiency. And then there's the arm of where they have residential services and programs for individuals who are 18 years of age and older, with the goal of maximizing independence. And so for some people, this may mean respite care. For some people, it could mean that they're living in a supervised apartment or group home. It just all depends, but there are a lot of resources as such that are available to individuals with intellectual and developmental disabilities who receive services from the Developmental Disability Services Division. Next slide, please. So the Adult Day program is another wonderful program that's housed under the Aging and Disability Services Division. And it was specifically designed to offer activities for adults with special needs. They have a wonderful team. There is a wait list, and there has been a wait list there, though, for quite some time. They have reduced capacity since, the height of the pandemic, but they are still open and still they have programming. Actually, I was there a few weeks ago on site chatting with one of my colleagues. They provide therapeutic recreation. They have nutritious and hot lunches and snacks. I know before COVID, and they may start to gear up again, of taking the participants over to the zoo or to the museum or, different places in the community, music events. I mean, they do a lot and to ensure that there's a lot of stimulation. So, mental stimulation, emotional stimulation, and then they also offer caregiver support groups as well. Again, there's a wait list, but they do look to lift the wait list soon. And so if you want to learn more, you would still call the 703-228-1700 line. Some caregivers that I've talked with in the past have gotten been successful in getting their loved one into the Adult Day program, and they've dropped them off in the morning and come back to pick up their loved one in the afternoon after they get off work. But then the staff at the Arlington Adult Day program has also helped the loved ones to arrange for transportation as well. So that's an option. Next slide, please. Another wonderful service that's offered under Aging and Disability Services Division is the Adult Services and the Adult Protective Services Program. So both offer case management. It's just that Adult Services is voluntary. Adult Protective Services is not voluntary. So if at any point, and sometimes we've received calls of people wanting to file a report or a complaint, they can do it anonymously. If there's ever any sign of abuse or neglect or exploitation of an older adult, individuals are welcome to call. They can call the 703-228-1700 line as well to file a report and make a complaint about that, because we want to make sure people are safe in their homes. I know, I've talked to the supervisor in that program, and there have been cases that, he's alerted me of sometimes, unfortunately, children who have taken advantage financially. So that's financial exploitation, taking advantage of their parent. I remember a story that he shared where there was a college student actually, and the college student was taking advantage of his parent and financially exploiting him to get him what he needed. And so legal action is, definitely a consideration. And I know in that program, sometimes they're going to court often, right, to try to resolve and protect the rights of the Arlington County community members. Next slide, please. So when we think about red flags for elder abuse, there are many. These are just some. So there's, physical abuse, there's mental or psychological abuse, sexual abuse, there's neglect, there's self-neglect, and then there's the financial exploitation that I just provided an example about. So if they want to, if someone ever wants to report, and we've gotten calls in the AAA from people who want to file a report, they can call the 703-228-1700 line, or they can report it by calling the toll-free Adult Protective Services hotline, which is 1-888-832-3858. Again, it's 1-888-832-3858. Next slide, please. So as it relates to home-based services, and then I'll pass the baton over to Yordi, there are many home-based services under the umbrella of Aging and Disability Services Division. And they get calls all the time in the ADRC about how they can receive some support in home. And so there's the Community Living Program, which offers Arlington County residents that are homebound and need assistance with either light housekeeping or laundry, to name a few. Sometimes individuals obtain support with someone going to the grocery store for them or helping them to get to a medical provider. It just all depends. There is an eligibility requirement. There is a screening process that needs to happen, and it's based on a sliding scale fee. So after the criteria, after the paperwork is completed, then the social worker will go through and talk about what the fee for services are. There's also a way for individuals to obtain this type of help and support on their own. So there are some referrals made to the community. I know Fairfax County has a list too of resources and services that individuals can access. So if they want to hire someone like a personal care assistant to come into their home, they're more than welcome to do that as well. There's then also what's called the Medicaid waiver program that's offered through the Adult Services Program, and this is specifically for individuals who have been approved for Medicaid who need some support around long-term care. And then there's the Nursing Case Management Services team. We have a great nursing case management team, and the nurses provide support in the community. Of course, they're going out into the community and into people's homes to help them maintain their quality of life and their health in their home. They work with a lot of individuals who have multiple chronic illnesses and or disabilities, and help them. They do medication monitoring, they check their blood pressure in their home. And we've also gotten some good referrals from our colleagues within nursing case management, especially around open enrollment. So sometimes people, want to look at ways to reduce their prescription drug costs, and nursing case management then makes the referral over to VICAP for our team to be able to assist and support with that. And so with that, I will turn it over to Yordi. Thank you.
Thank you, Michelle. All right. So hi, everyone. Again, my name is Yordi. Moving forward, we'll be talking a little bit more about the VICAP side of things as well as Medicare. So on this first slide, I'm just going to introduce what VICAP is. So VICAP is a state health insurance assistance program. The term stands for Virginia Insurance Counseling and Assistance Program. We provide in-depth one-on-one insurance counseling to Medicare beneficiaries, their families, friends, and caregivers. There are other state health insurance assistance programs in different localities. They may not go by the name of VICAP, but they are all certified to provide the same level of assistance. In Arlington, our VICAP team consists of staff and volunteers who provide Medicare counseling to Medicare beneficiaries, their partners, neighbors, and caregivers regarding Medicare Parts A, B, C, and D, and Medigap policies. We'll discuss a little bit more on later slides about what each of those covers in the next few ones. We also provide counseling on Medicare claims and billing, filing for Medicare-related benefits, and income-based programs that will reduce the cost of Medicare expenses, such as Medicaid and extra help. Okay, go on to the next slide. So what is Medicare? Medicare is a federal health insurance that was enacted in 1965. The purpose of it was to provide health insurance coverage for three groups of people: people who are 65 and older, people under 65 who received Social Security disability insurance benefits for at least 24 months, and individuals of any age who have end-stage renal disease or Lou Gehrig's disease. Um, Medicare is administered by the Centers for Medicare and Medicaid Services, also known as CMS, and there are four parts to Medicare. The first is Medicare Part A, which covers your hospital insurance. Sorry, that's also known as your inpatient care. You'll automatically get enrolled in premium free Part A through Social Security on your 65th birthday if you've been working in the US for at least 40 calendar quarters of work in any job where you paid Social Security taxes. And I believe that equates to about 10 years. Uh, if you don't meet the criteria for premium free Part A, then you'll likely pay a monthly premium that may be based on how many years you or your spouse worked in any job at which you paid Social Security taxes in the US. The second part is Medicare Part B, which covers your medical insurance. This is also known as your outpatient care. This is the part of Medicare that you have to enroll in yourself through the Social Security Department. This part is not premium free. Everyone would be required to pay a premium unless they have something called a Medicare Savings Program, which is a story for another day. The third part is Part D, which covers your prescription drugs, and the fourth one is Part C. This is also known as a Medicare Advantage plan. Part C and Medicare Advantage are used interchangeably, so anytime you hear someone say, I have a Part C plan, that means they have a Medicare Advantage plan and vice versa. This part of Medicare can be seen as a bundle plan. It includes Part A and Part B because it has to, and sometimes Part D. Okay. So in this slide, this next one, it shows a breakdown of the two ways that you can get Medicare. The first is Original Medicare, which is on your left-hand side. You'd get your Part A premium free again if you have at least 40 calendar quarters of work in any job where you paid Social Security taxes in the US. You'd also get your Part B with Original Medicare, which you would be responsible for enrolling in yourself again through Social Security. And again, you would be responsible for the Part B premium. And then you also have Part D. With Original Medicare, you would need to purchase a standalone Part D plan, which will have its own separate premium as well. That can range anywhere from like $7 a month to $99 a month. And lastly, with the Original Medicare, you can get what's called a Medigap policy. This is also known as a supplemental insurance plan. So Medigap policies are sold by private insurance companies. So if you have a Medigap, it pays for part or all of certain remaining costs after Original Medicare pays first. We'll talk more about Medigaps later in the presentation as well. The second way that you can get Medicare is through a Medicare Advantage plan, or Part C plan as we call it. You can also get a Medicare Advantage plan once you have Medicare Parts A and Parts B. These MA plans have to offer the same exact Part A and Part B benefits offered by Original Medicare. And again, these plans are usually seen as bundle plans because, unlike Original Medicare, they typically include drug coverage. However, you may be able to add drug coverage to some plan types if they're not already included in your Medicare Advantage plan. Um, and lastly, one important thing to note is that you can only get a Medigap policy to help cover those gaps in your healthcare costs if you have Original Medicare. Medigaps do not work with Medicare Advantage plans. Okay. Um, so let's go a little bit more into detail about the different parts. So just digging a little deeper on what each of the four parts of Medicare cover. Again, Part A covers your hospital care. That is your inpatient hospital stays, your skilled nursing facility care, which has to be our participating skilled nursing facility, and you must be an inpatient for 3 consecutive days or longer for coverage. Part A also covers home health care services only if you're homebound and need intermittent skilled care. Again, the agency has to be Medicare approved. It also covers hospice care if you're expected to live 6 months or less, and the hospice provider has to be a Medicare approved provider. Your Part B, again, it covers your medical care, such as your doctor services. And keep in mind, you pay nothing if the doctor accepts assignment. Part B also covers your outpatient services and supplies. With outpatient care, Medicare typically covers 80% of the bill, and you are responsible for the remaining 20% when the doctor accepts assignment. It also covers telehealth services, and the same fees apply with telehealth services as in person. And lastly, it covers some preventative services such as your Welcome to Medicare annual wellness visit and COVID-19 tests. Okay, so in recognition of Mental Health Awareness Month, which falls on May, we also wanted to highlight some of your Part A and B covered mental health services. Medicare Part A hospital insurance helps cover mental health services you get in a hospital that require you to be admitted as an inpatient. You can get these services either in a general hospital or in a psychiatric hospital that only cares for people with mental health conditions. No matter which type of hospital you choose, Part A will help cover inpatient mental health. Those inpatient mental health covered Part A services include the room that you stay in, your meals, the nursing care you receive while you're there, any medically necessary lab tests and medications, and also therapy or other treatment for your condition. And for your Part B covers outpatient mental health services that include services provided outside a hospital, like in a clinic, a doctor's office, or a therapist's office, and services provided in a hospital's outpatient department. Be sure to ask your doctor or psychiatrist if they accept assignment before you schedule an appointment. Part B does help pay for the following covered outpatient services, um, and deductibles and coinsurances might apply, so keep that in mind. It covers one depression screening per year, individual and group psychotherapy, a psychiatric evaluation, diagnostic tests, medication management, and also outpatient mental health services for treatment of substance abuse. So in this next slide, we have our Part C, which again is Medicare Advantage, or also known as an MA plan, which I should have also mentioned. You have to have Part A and Part B in order to join a Part C plan. Most plans include Part D drug coverage, again with Medicare Advantage plans, and each plan has different rules that can change each year. So you do have to live in your plan's network. You may be charged different out of pocket costs, and also MA plans don't work with Medigap policies. Now, with Part D, which again is your prescription drug coverage, you have to be enrolled in Part A and or Part B to enroll in a prescription drug plan. So you don't have to be enrolled in both A and B. You can be enrolled in either. But again, that also depends on your circumstances. If you do not have other drug coverage, you should enroll in Part D, even if you're not taking any prescriptions at the time of enrollment. This is because you could face a Part D penalty for every month that you are without drug coverage that is as good as or better than a Medicare prescription drug plan. This penalty is known as a premium penalty, and unless you have extra help or some form of creditable drug coverage, then you will pay the Part D premium penalty in addition to the Part D premium, essentially for the rest of your life. Also, we encourage people to purchase their prescriptions from what we call preferred in network pharmacies in order to save costs on your prescription drugs. Okay, so with Medigaps, Medigaps are again health insurance policies sold by private insurance companies, excuse me, and each company decides which Medigap policies it sells and their price points at which they want to sell them for. These policies are usually identified by letters, so you could have a policy A, B, C, D, F, G, K, L, M, or N. And while the prices for these Medigap policies may differ, the benefits offered in each Medigap policy letter have to be the same. So, for example, United Healthcare and the American Benefit Life Insurance Company can sell a Medigap policy N, as in Nancy, for different prices, but their policy N has to offer the same benefits. It only works with original Medicare. um, it fills gaps in original Medicare like deductibles, coinsurances, or copayments. And the best time to buy a Medigap policy is during your 7-month Medigap open enrollment period. This period automatically starts the first month you have Medicare Part B medical insurance and you're 65 or older. This period can't be changed or repeated, and after this enrollment period, you may not be able to buy a Medigap policy. However, if you are still able to buy one, it may cost more due to past or present health issues. Okay. So, a few things you should know about what Medicare does not cover. Medicare does not cover long term care services. It does not cover in home services like personal care or housekeeping services. It doesn't cover routine dental care and dentures, cosmetic surgery, or hearing aids and eye exams. Um, Now, there are some Medicare Part C benefits that may offer limited dental, hearing, and vision benefits. But if you are considering a Medicare Advantage plan, we just strongly encourage you to call the plan before enrolling so that you can discuss what those limitations are. Um, Also, Medicare does not provide coverage for family and informal caregivers, meaning that you cannot share your Medicare plan with other persons. You can't add a significant other to the policy or dependent or anything like that. That Medicare plan will be solely for you. And once the individual or a family member turns 65 or becomes eligible, then they will be able to um, singly buy or singly get Medicare. Okay, and some resources that might help you cover some of those items might include Medicaid, which may offer some long-term care benefits, community organizations, as well as some services offered by Arlington County's Department of Human Services. Okay. All right, I think we already went over this slide. Okay, well, some addition, I think we already, yes, resources that may help cover some items above. Yes, okay, so sorry guys. I think I got lost in the sauce for a second. Okay, so slide 27. All right. So, a little bit about becoming an authorized representative. An authorized representative, excuse me, is an individual who's chosen by a Medicare beneficiary to help with Medicare-related matters such as researching and choosing Medicare coverage options, handling Medicare claims and payments, and appealing Medicare coverage decisions. To name you as an authorized representative, or if someone else would like to be named as an authorized representative, um, You have to complete a form called the Medicare authorization to disclose personal health information. If your loved one is unable to complete that form, then you can do it as long as you have legal documentation giving you that right. The authorized representative document cannot be filled out and submitted online, but it has to be printed, completed, and then mailed to the address that's shown in the directions of the document. This is really important to submit because Medicare's privacy policy prevents personal information from being released to anyone other than the covered beneficiary. Okay. If your loved one's not enrolled in Medicare, but they are eligible, then here are a few things that you can do. You can review their enrollment periods with them so that they're aware of when they can enroll and avoid facing any potential late enrollment penalties. You can help them research Medicare coverage choices. You can explore options with them to see if there are additional support options. Um, if and when they plan to enroll, they would need to enroll in Medicare Parts A and or B through the Social Security Administration. Also, be sure to take advantage of speaking with your nearest state health insurance assistance program team members like ourselves during the open enrollment period, which falls from October 15th to December 7th, so that you and or your loved one can assess costs and review plans. And lastly, raise your hand and ask for help. The county has an array of resources, just as Michelle had mentioned, and we are here to ensure that you receive all the resources that you need in order to remain independent. Okay. So, in contrast, if your loved one does have Medicare coverage, then be sure to check the mail for any notices from Social Security Administration or Medicare. You can review the Medicare and You Handbook, they have an online version, but we also have hand copies or paper copies, excuse me. It's incredibly informative and it acts like both a dictionary and an encyclopedia for Medicare related information. Um, Review the annual notice of change, also known as an ANOC. This notice lists any changes in your plan's coverage, its service area, or costs that will go into effect the following January. And also be sure to ask yourself the question, does your loved one's current coverage still meet your loved one's health and prescription drug needs? You can also review Medicare coverage choices using the Medicare.gov Plan Finder during open enrollment from October 15th to December 7th. This is the period where you can switch from original Medicare to a Medicare Advantage plan. You can switch from a Medicare Advantage plan back to original Medicare, or you can switch from one Medicare Advantage plan to another. And you can also change, or excuse me, you can also, it gives you a chance for beneficiaries to change their Part D prescription plans if they have a standalone Part D. Um, you can get support from our VICAP team here in Arlington by calling 703 228 1725. That is our Medicare Help Hotline. And if you're not an Arlington resident, you can search your nearest VICAP team for the same level of support using the shiphelp.org website, which will be listed as a resource in the end of this slide. All right, so questions to consider when you're assessing plans. Has your loved one's health needs changed? Because as their health needs change, so do the costs associated with it. So this may be an opportunity to consider different plans that might help lower costs for their health needs. The next question is, how has your loved one's financial situation changed? Has your loved one recently moved? Remember that if they move, they have to be on a plan that works in that specific service area. How frequently does your loved one travel? If you have original Medicare, then you have coverage anywhere in the US in the event of certain circumstances. However, if you have a Medicare Advantage plan, your plan may or may not cover care outside of its service area. Another question to ask is, are your loved ones' doctors and hospitals in network? This is important because it will impact the cost of your care. If you stay in network, you pay lower costs, but if you go out of network, you can end up paying for the full cost. Are your loved ones' prescriptions going to be covered? If it's not, then your local VICAP team or state health insurance assistance program can look at alternative options like patient assistance programs. Um, And then another question to ask is, should I contact VICAP for help? We are here again to support, so we encourage people to reach out to their VICAP teams. Okay, so when you research plans, it is also important to have your loved one's personal information like their name, date of birth, and physical address. Um, have your loved one's insurance information handy, like their Medicare card number, information if they're members of any other insurance plans, and have your loved one's medical information, such as their Medicaid list, or excuse me, medication list to include dosages and frequency, any physician lists that they have, health conditions and treatments, and also have your loved one's income information, including any plan premiums or payment options. So, a few quick tips on how to save money in Medicare. Ensure that your loved one's coverage fits their needs. Ensure that your loved one utilizes preventive services. Ensure that your loved one stays in the plan's network. Again, this is really important because if you're out of network, you're going to be spending more money. Review their annual notice of change. Use preferred versus standard pharmacies. Typically, you'll see on Medicare.gov Plan Finder the difference between a standard pharmacy and a preferred and network pharmacy is that yes, the prescriptions are covered, but they'll be covered for you at a higher cost if you do a standard pharmacy than if you did a preferred and network pharmacy. Ask your loved one's doctor for generic drugs or switch to a less expensive plan. And use pharmacy coupons or patient assistance programs. And then lastly, be sure to call the Arlington County VICAP team at 703-228-1725. All right, and um, I'll go over this really quickly and then I'll pass it back over to Michelle. So, some resources to help yourself or your loved one. For questions about your loved one's plan, you can call the phone number on the back of their insurance card. For Medicare questions, you can visit Medicare.gov and view their blog for caregiver resources. For guidance on home health services, covers, you can also visit Medicare.gov's website under their home health services section. And for general resources near you, you can visit the Administration on Aging's Elder Care Locator, which provides information and resources across all AAA programs across the US. Use pharmacy coupons or patient assistance programs. Again, this will help you save cost on prescriptions depending on what type of prescription you have. Visit the Caregiver Action Network online at caregiveraction.org, where you can find additional supportive caregiver resources. And for Medicare counseling, you can call Arlington County's VICAP team at 703-228-1725. Or if you don't feel like we're getting back to you fast enough, you can contact 1-800-Medicare. All right. And Michelle, I will pass this back over to you.
Thank you, Yordi. Great job. So as we round out this presentation, it's always important to consider self-care and caring for you because it's difficult to care for other people if we're not in an optimal state ourselves. And so as we've spent some time talking about resources and programs in Arlington County, but also spent some time talking about caregiving, just wanted to highlight this slide that talks about allowing time for yourself. I know that there are many caregivers that we interface with, and we're going to have a virtual program specifically on caregiving in the next couple of months, but we do hear from caregivers, throughout the year, especially during open enrollment, and they talk about the stress of helping their loved one move, or the stress of getting them connected to different providers, or the stress of finding providers and just not having enough time to do the things that they need to do, especially if they're in the sandwich generation and they have a small child of their own that they're caring for, in addition to an older adult. So there are just a lot of moving parts. We always like to encourage people that we interface with caregiver or not, to make sure they're taking time to care for themselves. Be able to feel comfortable to ask others for help and support. Our office is here, our team is here, the VICAP program, the AAA, the ADRC is all here to be able to offer some support. Earlier, we talked about geriatric care managers or legal services. It just all depends on what the individual needs at that moment in time, because sometimes questions come in that are just not solely Medicare related. There could be a myriad of questions or concerns wrapped into one. And so, we definitely encourage people to do what works best for them. So if you are a person of faith, maintain your faith. If practice meditation, meditate. If you like to walk, take walks, and things of that nature. Scheduling time with friends and loved ones can also be helpful too, as a way to be able to de-stress. Because again, if you're not your best self, it's really hard to show up for others, to help them in their time of need and to help them in their time of crisis. Some resources that we'd like to share are, of course, resources around Medicare and mental health. We do want to, continue to plug mental health awareness outside of May, because there are a lot of individuals, especially during the height of the pandemic, of where, people have felt isolated or been isolated, and it's led to maybe stints of depression. It just all depends. And so we want to make sure we acknowledge that. We want to make sure we're offering some resources around that. The Arlington Aging and Disability Services Division is where the AAA and the VICAP is housed under, that offers a plethora of services that we went over today. We also like to share information and resources about Medicare's home health and what that looks like. And then, of course, the elder care locator, continuing to remind people to use the pharmacy coupons. And I appreciate VICAP team members for offering those to the clients that we counsel, in addition to patient assistance programs. Sometimes the cost of medication can be exorbitant and very high. We've gotten calls in the past. I remember a specific call years ago, but it was so poignant because the gentleman was calling on behalf of his wife. He was in distress and he was trying to figure out if he should sell his truck to be able to get enough money to care for his wife and to pay for her medications. And we had many conversations around that. I believe at the time, his wife was diagnosed with cancer, and he had been shopping at Georgetown Hospital and GW and many other hospitals. And there are some medications, as you all know, that may not be covered, that may be out of pocket. There may be some medications that people have to pay that just aren't covered under a Part D plan, and so on and so forth. And so I, again, appreciate our team members for being able to connect people with resources to help reduce their Medicare costs. You already provided the information to our office. Again, I'll offer it one more time. I do see someone here joining by phone. Thank you so much for doing that. If people have questions for the ADRC or the AAA, they can call 703-228-1700. And then for Medicare counseling, they can dial VICAP directly at VICAP's hotline at 703-228-1725. And so with that, we can cease the screen share, and Yordi is going to put the link to the survey in the chat, and we'll offer a few minutes for completion of the survey, and then we'll open it up for Q&A, and then we can also stop the recording at this point in time. Thank you so much for your attentiveness. I saw some of you taking notes.